Hello, my name is Andi Agbejule, and I'm a cancer researcher with the Cancer and Palliative Care Outcome Centre based here in Queensland. Today's presentation is about survivorship education programs for primary care providers. So it's well established that PCPs are essential in the provision of follow-up cancer care. However, PCPs and residents studying primary care frequently report a lack of appropriate knowledge, training, and confidence to provide cancer survivorship support. So the aim of our systematic review was to identify existing PCP cancer survivorship education programs and their outcomes in published literature. We conducted a literature search between January 2005 to September 2020, and we only included articles and abstracts with published evaluated outcomes. An education program was considered to be about survivorship if it had at least one of the core domains listed in the Quality of Cancer Survivorship Care Framework, which you can see on your right-hand side. We also use Kirkpatrick's 4-level evaluation model to summarize program outcomes. So Kirkpatrick's framework really separates learning outcomes into 4 levels and 2 sublevels, and they cover participant reaction to an education program, learning outcomes such as knowledge and skills, the transfer of learning to practice, and the impact of learning at the patient and the organizational level. So our review found 24 articles representing 21 unique education programs. This slide shows the content across programs. So as expected, the intended cancer survivorship content differed across all programs, with some programs focusing on specific cancer groups, such as breast cancer, and the majority providing an overview of general cancer survivorship. Our review also identified that survivorship programs can be sufficiently delivered via a variety of modalities and settings, depending on clinician needs and context. So all 21 programs were reported as generally beneficial to learners. So PCPs reported increased confidence, knowledge, and an intention to change practice. However, only 3 of those studies evaluated and reported positive outcomes at the patient level and at the organizational level. So those are your Kirkpatrick level 4A and 4B outcomes. So as a result of our review, we developed 7 recommendations for developing and evaluating cancer survivorship programs. So this included the assessment of existing programs before we create new ones, the use of a survivorship framework to guide content, the delivery of pre-program learning needs assessment, and the use of learning theories, the evaluation of program outcomes to see their impact, and future research into the establishment of an optimal survivorship curriculum to really increase the relevance of the survivorship education to primary care practice. Thank you very much for listening.